Good day, I am Jocelyn May A. Lamusa, a student nurse of Southwestern University. So today I will show you on how the procedure of the bed bath and bed shampoo. The definition of bed bath is it is a type of bath given while the client is on the bed. The purpose of this is to make the client clean and feel comfortable and to increase well-being and to promote muscular relaxation and relieve feeling of fatigue. The needed equipments for this is a wash basin, bath blanket, a bath towel, washcloth, patient gown, hamper of soiled linen, gloves, hygiene supplies, soap, cali pad, and bedpan or urinal. Remember that the calipad is a medical device to funnel the liquid secretions and collect it in one area, while the bedpan is a receptacle used by bedridden patient as a toilet, and it can also be used to male or female patient. While urinal is a urine bottle used for male. So let us proceed to our procedures. So first is to assist the client's order and to know the ability to perform the self-care and level of assistance, and also gather the equipments in one area. Temperature and its ventilation to prevent chills of the patient and provide privacy by closing the curtains and closing the door to allay the fear of anxiety of the patient. Patient's permission and explain to them why it's necessary and how the patient can cooperate. But if the patient or relatives insist that they can do it, then explain it to them the procedure. Make sure to wash your hands properly or use alcohol or gloves and remove jewelry to prevent accidental wound on the patient and spread of microorganisms. In a comfortable working height position to prevent muscle strain on the health provider. Pull the side rails and remove the top linen by placing the bath blanket on the patient, providing warmth and privacy to the patient. We bath the body, we should do the hair shampoo first. It is cleaning the hair of the patient while on the bed. This is to stimulate the blood circulation of the scalp, to increase our client's comfort, and to assist the hair problems of the client or like matted hair or dandruff. Follow the procedure. First is to position the patient. When you place or position the patient, make sure that the equipments are ready, like the shampoo, the comb, and the air plugs. But as for now, we don't have an air plug, so we cannot use it for this procedure. Get the cali pad and place it under the head of the patient. Place the blanket on the nape of the patient and cover the rubber part of the cali pad. This is to prevent the damage of the nape. Has own shampoo, then use it. But if the patient did not any of shampoo, then you may ask permission of the patient if it is okay to use the brand of the hospital. Assess the patient's hair and check if there's a dandruff of wound and to avoid its cleaning. Ask the patient if there's any infecting pain to reduce the pressure in cleaning. And remove the matted or tangled hair using comb or your hand. Container and place the hanging edge of the cali pad in the container to collect the water. Get the water basin and place it near you. Check the water if it's warm. Wet the hair carefully and use the shampoo and rub it in your hands. Scrub the patient's hair in a circular motion. After scrubbing the hair, uh, rinse the hair by water thoroughly. And pat the dry patient's hair using the towel under the cover of the calipat. Get the washcloth and meet in your hands. And then wash it to the water basin. Wipe the patient's eye from inner canthus to the outer canthus. This is to prevent the entering of microorganisms to the eye and to avoid microorganism or the irritation in the eye. Do not use soap in the patient's eye because it leads to the irritation of the eye. Clean the face of the patient starting from the forehead, cheek to the chin. So starting from the forehead, cheeks to chin. The other forehead, cheek to chin. Next is clean the nose to the neck. So wash the cloth and knead it again into your hands. Starting from the back of the ear down to the neck using the long fur stroke. To stimulate the circulation, repeat the cycle to remove the dirt of the neck. Remove the washcloth and pat the dry neck using the butt blanket under the head of the patient. Yes. Next is the arm of the patient. Clean the arm of the patient near to you and to save up the time and effort and expose the arm of the patient one at a time. Place the towel under the arm to prevent the back of the linen from getting wet. Yes. Get the washcloth and wash it to the wash basin and meet it in your hands. Yes. Wash the client's arm without or with soap And use a long firm stroke and wipe it to the arm of the patient from upper shoulder to the upper up from the lower shoulder. In particular, to clean the axillary part, directly clean the fingers into the water basin and clean thoroughly between the fingers. Dry thoroughly the arm and remove the towel under the arm and bring back the arm under the towel at the back blanket. Next is the upper body. Wash the cloth and meet it in your hands. Use a long firm stroke and wipe it from the neck and to the abdomen and umbilical area. Pat dry the pat of the upper body using the bath blanket under the nape of the patient's shoulder. Next is turn the patient in a side lying position. Wash the cloth and meet it again into your hands and use a long firm and wipe it by starting from the nape of the patient down to the buttocks. The dry back of the patient using the bath blanket. And bring back the patient to the supine position. Next is the lower extremities. Expose uh, the leg at a time. Then wash the cloth and meet it again in your hands. To put the blanket under the lower leg of the patient. Wipe it from the upper leg down to the lower leg. Be particular in the popliteal and inguinal area. You can wash the feet of the patient using the water basin. And next is pat the dry leg using the blanket. And remove the blanket and bring back the leg under the blanket, under the top lining of the patient. And you can repeat to the other side of the patient. So next is cleaning the perineal part of the patient. Insert the bedpan of the under the sacral part and position the patient in lithostomy. So if the patient or relative insist that they can do it, then explain to them the procedure and guide them on how to do the procedure. So evaluate the other needs of the patient and document and any circumstances in the body of the patient. I hope I have clearly demonstrated on the proper procedure of the bed shampoo and a bed bath. So once again, I am Jazinme A. Lamuso, a student nurse of Southwestern University. So that's it for today.